If you have bunions, you know how painful it can be to wear shoes, but some people think that bunions are caused by shoes, and that's just not the case. Dr. Mojgan Tavakoli, DPM, and Dr. Horst Knapp. DPM is of Foot and Ankle Center of Frisco and Plano. They're here to let us know that that is not the case, but also details on Lapiplasty 3D Bunion Correction, a new procedure to alleviate bunions. I'm sure a lot of people are excited to hear about some relief that can come their way. Good morning.
Good morning, Alana. Well, thank you for having us here.
Happy to have you here. I'm very happy, because I was also one that thought that shoes cause bunions. So what is a bunion and who do they impact?
A bunion deformity is a three-dimensional painful deformity of the great toe joint. This deformity is caused by instability of the midfoot. This instability causes the great toe joint to lift, rotate, and slide from the side of the foot. It's causing a painful bump, and this bump aggravates when we wear shoe during our activities, daily activities.
Especially wearing high heels, yes. I've heard.
It is a hereditary progressive disorder or disease. Because it's progressive, usually affects the middle-aged men and women during their period of their time that they're very active, they are in life, and they wanted to be doing a lot of activities.
At what point should we consider getting surgery?
Once the bunion becomes painful in shoes and stops you from performing the activities you want to do or the activities that you must do, it's time to consider having surgery. Putting a pad or a spacer between the toes is not going to be addressing the root of the problem, the root cause of the problem.
Okay, well, how does this, we're actually discussing the Lapiplasty 3D Bunion Correction. How does this compare to maybe the traditional 2D surgery?
Okay, traditionally we perform surgery by removing the bump with a bone saw and doing a bone cut right behind the big toe joint to slide the bunion over to make it more narrow. Unfortunately, this doesn't address the root cause of the problem. The problem occurs at the midfoot joint and it needs to be corrected there. When you do the 2D traditional bunionectomy, the big problem is recurrence. About 70% of patients will have a recurrence because the problem is progressive. It continues to go the wrong way. So with the 3D correction at the midfoot joint, we use these titanium screws. Can you pass me the model? We use these titanium plates, I'll just take it this way, across the midfoot joint here, and these plates allow the patient to begin early weight bearing after the surgery, and the problem of recurrence just goes away.
How long is recovery?
The recovery period, patients start weight bearing as soon as 2 weeks in a protective walking boot, and as soon as they can start feeling that there's no pain, they can start walking. And 6 weeks to start wearing comfortable shoes and start running, performing exercises, activities as they like.
Is it covered by insurance?
Since this is not a cosmetic procedure and it's instability of the midfoot and misalignment of the joint, and it's progressive, it's causing buckling of the second toe in late stage of this deformity, causing pain on the ball of the foot, and most commercial insurance cover this, and also is covered by Medicare.
Okay, well, that is good to know.
Thank you.
I love the visual you brought here for us, and I know you're probably going to bring a lot of people relief, or they are curious to find out more, so I'm going to give them that information
so much.
To do that. Pleasure talking with you both. You can go to alignmytoe.com for more information on Lapiplasty 3D Bunion Correction. Includes risk of benefits. Call 972-712-773 or go to dfwfoot.com to get in touch with Dr. Tavakoli and Dr. Knapp. Thank you guys for being here.